I feel that I know more about my medicines through my interaction with the pharmacist. I know exactly why I take each item and what it does and what the side effects are.
I was very impressed to get 40 minutes with a professional sorting out medication, which a doctor doesn't have time to do. I thought it was fantastic. And he was very good. Tested my chest, all sorts of things, as well as sorting out the medication. Even had a look at my feet, as I'm type 2 diabetic. And all round, very, very impressed.
Things get started in really good faith, and this is not about saying that, you know, a decision that was made maybe 5 years ago or 10 years ago is now wrong. The point is that the patient is now 10 years older, they've now got other conditions and they've got other medicines, and therefore that decision is therefore perhaps not the right one anymore. Most of the medication reviews I do are for people who are taking more than 8 or 10 medicines. So my job is to look at the patient as a whole, okay, and holistically look at all the conditions, all the medicines, and usually we find there are opportunities where we can either stop things or change things so that we providing the same benefits and potentially causing less risk of harm as well.
The Royal College of GPs made a recommendation that patients with a lot of long-term conditions and on a lot of medicines should ideally have face-to-face reviews with a medicines expert because it gets very complicated. And what we've done, I think, which is really beneficial, is we can start clinics which are face-to-face consultations so that patients can discuss on an individual basis exactly what they're taking and if it's appropriate.
I saw a chap yesterday, very complicated. He's had a sort of bone marrow transplant, so he's on lots of prophylactic antibiotics and things. But he'd had a potential reaction to one of them, and the specialist at the hospital had changed him to a different one. But actually, this guy has also got quite complicated heart disease, and therefore the change of antibiotic meant that that was potentially not a good idea because of his heart medication. So I was able to intercept that and then speak to the GP, and we agreed that actually we weren't going to carry on with that, and we would let the specialist know that actually we were concerned about that.
So I'm convinced pharmacists do have a role in helping reduce hospital admissions and improving the experience from discharge from hospital. And I think one of the main things we're seeing is patients on complex polypharmacy or lots of medicines. As they get older, the body just doesn't tolerate the medicines very well. And I think there's good evidence that patients on high numbers of medicines are more likely to end up as unplanned admissions to hospital.
Living in a retirement home, I moved in a year ago. This little group that I'm in were very impressed, very jealous. They want it. A lot of them have said that they're worried about their medication. They've been on it a long time and would like it sorted out.
I used to work in hospital for 27 years, so the difference between working in the hospital and working here is so different, because in the hospital I may interact with and deal with a patient but may never see them again. Whereas here I feel like I'm part of the team that's looking after these patients every day, and changes that I make with the team can affect that patient's life for the rest of their life.